So my name's Ananda Peters. I live in Rapid City, South Dakota. My husband Joe and I have 8 kids, ages 3 to 20. I'm originally from Canada. My background's in journalism. I love writing and reading. Those are like my 2 big hobbies. I love people, ice skating. Okay, so let's see. My son Reeve, so he's number 6, was born in 2014, and I had some rectal bleeding after he was born. It was really painful, and I went to the doctor, and she did an exam and said you have a fissure, like FISSURE. And so really increase your fiber, drink lots of water, that kind of stuff to clear it up. So I did that. Magnesium was amazing. That really helped. And then it did clear up and went away. So then fast forward 2 years later, my son Avram was born in August 2016. I had some more bleeding. And so I was like, oh, okay, I've been here, done this. And I just started taking more magnesium and fiber and lots of water, and it wasn't clearing up. And it wasn't every time, it was just kind of sporadic. But I was like, gosh, and so I would take like 2 magnesium, which would, usually that's like way more than enough. And I was still having this blood on and off. And then in January of 2017, so 5 months after he was born, my uncle was diagnosed with stage 4 colon cancer, and he died shortly after, like a month later. And so I was like, okay, I need to really get on my issue. Well, I had gotten pregnant again, and then had a late miscarriage. And so going for this colonoscopy or just even going to the doctor was kind of on the back burner. I finally went in, I believe it was July of 2018. And I said, my uncle died last year. And the doctor said, well, are you having any pain in your stomach or any other symptoms? And I said, nope, just blood every once in a while. And she said, with your history of having all these babies, like, I'm so sure it's hemorrhoids. Your risk of getting cancer at this age is so slim. She said, at your age and your health level, and she did an exam and said, yeah, I can feel the hemorrhoids. And so she gave me the hemorrhoid stuff. And then she said, if it doesn't clear up, come back and see me. But we were in the middle of an interstate move. And so it was like, okay, whatever, that, check that off the list. It was hemorrhoids. And then, but it didn't really go away. And it seemed like it was getting kind of weirder. And I'll just be really graphic because I know that people watching this, other patients, do appreciate that. I did, knowing the details about it. And so it became more mucusy. And then there was one point where it was like I passed a hard, like maybe the size of a grape, like a hard thing in the toilet. And it wasn't poop. And so anyway, so now I was pregnant again. I mean, I've just been pregnant nonstop, but so I talked to the doctor and she said, okay, absolutely. After this baby's born, then we'll get you in for a colonoscopy. But that doctor, my primary care doctor, she said, I'm so sure it's hemorrhoids. So this is a different doctor than I'd gone to before. And so my son was born in January 2020. He was born like the day that the world announced COVID, the day the insanity set in. And I had troubles nursing him, which as a mom, y'all, breast is best. And you always feel so guilty if you can't nurse. I mean, a lot of moms feel that. And I felt like this is my 8th, I should be able to. But because I had all these other kids, I just couldn't get in the right frame of mind to even devote as much as I needed to nursing him. So I put him on the bottle, which I felt kind of guilty about, but was a huge blessing because if I was nursing that, I would have put the colonoscopy off for another year. So, so that he was born in January. Then April, I went for the colonoscopy. So this is April 2020. And again, the gastroenterologist said, I'm so sure it's hemorrhoids. And I had a close friend of mine was diagnosed a year before me. She was exactly my age, and she was diagnosed with colorectal cancer. So when I told her my symptoms, she's like, get in for that colonoscopy. So even though it was kind of dismissed, I was like, no, I really want this. And so I was 44 at that point. And so, yeah, the doctor said, the gastroenterologist said, I'm sure that it's hemorrhoids. And she said, we'll talk about it when you come out. We can do like a banding procedure. It's real simple. And so I went to sleep and I woke up, and, the N95 masks because of COVID and all that. And the doctor was just looking at me, and she said, I am so sorry. Like, I did not expect to be telling you this, but there is a large mass in your rectum, and I'm quite sure it's cancer. She said, it's very hard. I couldn't even biopsy it. She said it was just too hard. And that's generally a sign of malignancy. So, so that was like a huge shock. I mean, you're never ready for that. That's what everybody always says. You're just never ready for that. I called my husband. He wasn't there with me because he was watching the littles. And so he came, and then it was like, the next steps were, I'm a pretty organized person, but when you get news like that, it's like, where do we even go from here? So the doctor said she would call me. Let me see. I guess they got a small sample. They got a small enough sample for a biopsy because she was sending it to pathology. And so she called, like, I want to say that was a Friday, and then she called Monday. I could be wrong on the dates, but it was like not immediate. I didn't know immediately, although she did believe it was cancer, but we didn't know for sure. So I called the Mayo Clinic, and they were just starting to open up again after locking down. So they were just opening up some appointments. It was 4:00 in the afternoon, and they said, can you be here at 8:30 tomorrow morning? And I said yes. And I didn't even know where it was. I didn't know where Rochester, Minnesota was. I mean, my US geography is not wonderful, being from Canada. So I told them I would come, and then I got online and saw it's a 10-hour drive. And so I called my husband, and we were like, okay, who goes, who stays? And so I brought my 15-year-old daughter, who had a learner's permit, to help drive, and my 3-month-old baby, because he would be the most work. And so we just drove through the night. She drove through the night on her learner's permit at night to Minnesota. We got in at like 6 in the morning or 7 in the morning, and I just like showered and went to this appointment. And they are so efficient. I mean, it was like, get in for this appointment with the gastroenterologist, and then what did they do? They did like a CT scan and an MRI. And I don't remember if they did the lower ultrasound at that point, or if that was a later, I think they did at that point. And by the end of the day, they know what you have. Like, they are just so quick and so efficient. And so went in the afternoon and talked to the oncologist. I believe, I'm not sure exactly if it was all one day or if it was like over the course of a couple of days, exactly how it unfolded. I know the results came in very quickly. We knew, yes, this is cancer. And then I met with the surgeon. Right. So it wasn't the oncologist. It was the surgeon first. And he just came in, and he does this all day, every day. He does rectal surgeries, and he teaches other people to do rectal surgeries. And I just remember him coming in and sitting up on the bed, in a suit, and he was very professional, and but casual, he was like, yeah, like he knew what he was doing. And he said, okay, here's what's going on. We're going to do the surgery a month from now. So they scheduled it for June 1st. And I was like, a month? What if the cancer spreads through my body? And he explained that colorectal cancer is very slow progressing, at least the kind that I had. I'm not sure if that's for all kinds, but it's a certain grade. And he said, you've probably had this 6 to 8 years. I was like, whoa. I mean, even back when I had that fissure those years ago, there was probably some rectal cancer already going on. So anyway, went back home, came back June 1st, had the surgery. It was quite a long surgery. They got it out with clear margins, but when I went in, they thought it was probably a stage 1. But I'm up, I'm not in pain. They have the pain really well controlled. They thought they had caught it early. When they did the pathology post surgery, they realized that there had been a small breakthrough through the rectal wall into the fatty tissue, which made it a stage 3B. And so because of that, they recommended adjuvant, I don't know if that's how you say it, I think it's adjuvant chemo, just in case, just to kind of make sure it doesn't come back. And so that was to start a month later. So that started in July of 2020. And that was 4 months of that. That was the most traumatic thing probably that I've had to go through. And it's just the mental difficulty of knowing that you're putting poison in your body, and knowing I didn't have cancer anymore. The cancer was gone, but I willingly was allowing, they come into that chemo room in almost like a hazmat suit, because they don't want to touch the chemo. The nurses are head to toe garbed up, and yet they put the needle into your body. They can't touch it. It's such poison. And yet I'm willingly letting it be injected into my veins. So I really struggled with it. I wanted to quit. I did quit. I called my oncologist and said, I'm done. I was doing it in Rapid City. So they basically explained chemo is chemo wherever you have it done. It's not like you want to be with the best chemo doctor or something. It's very standard. So I decided to do that at home. But when I called her, she kind of talked me back into it, and explained the statistics and this and that. I was doing the oral chemo, which made me very sick, and my stomach hurt really bad. And then they switched me to Folfox, I believe, which is the what do they call it? It's a pack that you wear for 2 days, and then they take it out. And I didn't get sick with that, which was amazing. That was just an answer to prayer, because the oral chemo for me was awful. I've heard other people say they liked the oral chemo, but it was just awful for me. So so that time was really, really, really difficult. And it was fear. It was absolute terrified for my kids, and thinking I'm 2 stages away from terminal cancer. In between me and stage 4, there's only 3C. And I have a little baby, and I have I have to think back to the ages, but I mean, I had a lot of little kids at that point. And my teenage daughter was going through just a really hard time, and I couldn't be there for her. And that was so difficult. And then my son graduated from high school. And so it was wanting to celebrate that, but just being in the mindset of survival mode, really. And all these big things are happening. And it was just so difficult to function, I guess. It's really good to talk about it right now, because it was pretty traumatic. And to the processing the trauma, I think, is takes a long time. And then you think you're over it, and then something will come up like this, having a conversation, and you will, that was really, really scary. I felt like I should have been stronger. But I just wasn't. I just mentally, the anxiety, I mean, I would go outside and just sit there and breathe, just tell myself, okay, like, and it was hard to actually just slow down my body to breathe. They did give me stuff for anxiety, Ativan, which helped me sleep at night. I didn't take it too much because I actually really liked it and I thought I would get addicted to it. But it did help me for a short time. And then, yeah, rang the bell in November of 2020. And the cancer has never returned. They told me that with rectal cancer at the Mayo Clinic, they said we have a very low recurrence rate, which was kind of the opposite of what I was reading online, was that rectal cancer has a high recurrence rate. But they said at Mayo, what they see is that it's not a high recurrence rate. So that was really good. So basically that surgery was 3 years ago and no recurrence. And I just go regularly for CT scans. And like it was every 6 months, and then now it's just once a year. And they said once we get to 5 years, so 2 more years from now, they said the chance of recurrence rate will be the same as the general population. Like the chance of getting rectal cancer would be the same as anyone else getting it. I think God gives us an instinct about our bodies that there's like, you don't know what it is and you can't pinpoint it, but something is wrong. And that's a real thing. That's a real voice to listen to. And I would say just be your own advocate. I know doctors don't like when you go online and do all this Dr. Google research, but I learned so much. And my sister came down from Canada for like a month or 5 weeks, and the two of us were nonstop reading all these medical journals, and we found out a lot of stuff. And we would call the doctors at Mayo and be like, what about this, and we were pretty impressed with our own knowledge. I don't say that boastfully, but my point is that you can learn about what's going on with your body, and not to trust. Not that doctors aren't trustworthy, they're very trustworthy, but they are not inside your body. So they don't feel that feeling of something is off. Only the patient feels that. And that's a real thing, to listen to that. They said, I was told that a lot of times with at least colon cancer, you don't see blood. With rectal cancer, it's more common because, of course, you're closer to the opening. As far as genetic, they did the genetic testing. There were no genetic markers. But, I don't know. I feel like because my uncle died from it, that maybe there's some predisposition. My dad had polyps removed when he was a young man, and he forgot all about it. My mom brought it up and said, oh yeah, your dad had polyps removed when he was like 19. And I said, Dad, you never told me that. Oh, I forgot all about that, dear. But all my family got their colonoscopies, all my siblings, who I'm the second oldest, so most of them are younger than me, and they nobody had any issues. They were all good. I mean, there was like a couple polyps, and my dad had a colonoscopy and he was all good. So it's really hard to say. I mean, I think the thing that really threw me off, and I wish I had known, is just that all of the anxiety and the fear is like, it's part of it. It's not like you're not strong enough to handle this. It's like, this is part of the process. And my medical team was really good about explaining that to me, but I didn't know it until I was far into the process. But I remember like the one pharmacist called and she said, managing anxiety is an important part of your care plan. And I felt up to that point kind of guilty, feeling so fearful. I mean, I was so terrified. And I was like, this could be it. I mean, this is what happens. People just all of a sudden get a diagnosis and then they die. And I was just so scared for my kids. And I had a friend who had never had kids, has never been married. And she didn't understand. She said, oh, you need to think about you. I mean, she didn't say it like that. she's very kind, but she said, you need to focus on you and not just be thinking about the kids. And I couldn't not think about them because I'm a mom, and it's like instinctual to just constantly be thinking about your kids. So that's what I wish I had known. It's like the anxiety is going to be crippling, and it's not your fault. It's part of this that goes with it. And the other thing that I really learned was just to lean on my faith. Like I didn't have the frame of mind to pray, and it was more like I would put scriptures on my phone and just read them kind of in my desperation. Things like, God is a refuge and strength and ever-present help in times of trouble, and those kinds of things. Like, okay, I'm not in this alone. Like I had my sister, my sister-in-law, my husband. I had friends. My friend Amy, she drove me to all these chemo appointments. She was amazing. I had a good human team, and I had God that I just relied on, and we got through it. And that's the thing. There is an end. And even, for patients that are diagnosed with stage 4, like my friend Julie was diagnosed with stage 4, but like it's a day to day, but there is strength. There is hope. This doesn't have to be a hopeless situation, that there is hope in the midst of it.